The Kenya Union of Clinical Officers has suspended its strike for 21 days in 43 counties, starting Monday next week. The union officials say the suspension will pave way for negotiations with the government in a bid to break the existing deadlock. Meanwhile, the country has replenished the critical childhood vaccines to address a shortage witnessed in recent weeks. 2.3 million doses of BCG and 7 million doses of measles rubella vaccines arrived in the country on Tuesday.
On the second day of the national strike by the clinical workers that had threatened to paralyze the provision of medical care in hospitals, the Kenya Union of Clinical Officers has suspended for 21 days the strike that started on the 20th of January 2025.
We hereby suspend our strike for the next 21 days. And I must clarify that 21 days begin Monday, because Monday will be the first day when the team will be meeting.
Sisi hatujamaliza mgomo, tumesitisha kwa wiki 3. Na tuko na nguvu na tuko na uwezo wa kurejea kwa mgomo. Tunausitisha ndio tuweze kukua na maongezi kama vile serikali ama waajiri wetu wameweza wakatuuliza. Wasipotimiza haya kwa siku 21 tutakuwa tunarejea kwa mgomo.
The strike, however, will remain active in Lamu, Kwale, Vihiga and Uasin Gishu counties.
Solidarity forever.
Doctors in Siaya today, in the meantime, have begun a strike, accusing the county government of failure to honor a collective bargaining agreement signed with the Kenya Medical Practitioners, Pharmacists and Dentists Union.
Our key grievances are promotion and redesignation, lack of health insurance, and severe shortage of personnel that has placed an enormous strain on our existing workforce.
Meanwhile, the government has replenished critical childhood vaccine stock, ending weeks of uncertainty for infant mothers.
The country has been grappling with a shortage of the BCG vaccine, which is supposed to prevent us from getting tuberculosis. And we are disclosed that before the end of the month, we are supposed to receive 2.3 million doses of the vaccine. I want to affirm that we received the vaccines the day before yesterday in our Kitengela stores, and distribution of the vaccines have commenced to the 9 regional depots.
Nairobi County received 450,000 doses of the BCG vaccine, Kisumu 300,000 doses, Kakamega 276,000 doses, Nakuru 264,000 doses, Mombasa 120,000 doses, Meru 90,000 doses, Nyeri 90,000 doses, Garissa 120,000 doses, and Eldoret 290,000 doses.
We have kept a stock of 234,000 doses at the national level to be able to maintain the buffer stock. In terms of logistics, usually we are supposed to keep 6 months worth of stock.
The government has in the meantime refuted claims that the Social Health Authority is discriminating against patients who are not civil servants.
We have a separate scheme for civil servants, but the benefit I've talked about is available to all Kenyans who are registered under SHA.
We are not saying we are separating civil servants and the rest, but there was already an existing scheme that was for civil servants. And what is being done is transition of the same.
So far, over 18.2 million people have registered under SHA, with principal members urged to register their dependents. Nancy Okware, Prime Edition.